Non-communicable diseases are a result of a combination of genetic, physiological, environmental, and behavioral factors. They are chronic in nature, with a quiet onset, usually asymptomatic in earlier days, manifesting when the situation is worse and irreversible in most cases. Uganda continues to face an alarming rise in the burden of non-communicable diseases and mental health conditions. The non-communicable diseases include cardiovascular diseases, cancers, diabetes, chronic respiratory diseases like asthma and chronic pulmonary obstructive disease, sickle cell disease, and other chronic conditions such as kidney disease and others. These are currently responsible for over 41% of all the deaths in the country, with a 22% chance of dying prematurely due to non-communicable diseases. When we talk about premature death, we need dying before 70 years. Any death that is associated, that happens before 70 years of age, in our medical terminology, we call it premature. And a Ugandan has a 22% chance of dying before 70 years due to any of these non-communicable diseases. A Ugandan will either die of cancer, or die of heart disease, or high blood pressure, or he will die of diabetes, or he will die of a mental health condition or any other condition. Equally concerning is the mental health crisis. Approximately about 5 million Ugandans suffer from depressive disorders, and over 1 million live with anxiety disorders. The abuse of alcohol, tobacco, drugs, particularly among young people, is a driving factor for mental health conditions. The most common risk factors are modifiable, meaning they can be reversed. These modifiable risk factors include unhealthy diets, which I will explain later, harmful use of alcohol, tobacco use, and substance abuse, and physical inactivity. These modifiable risk factors are easier to address, and they are usually the focus of the prevention for non-communicable diseases. They are also risk factors that we call non-modifiable. These include age. As you grow up, there are conditions that come, like cancer of the prostate for men, usually 40 years and above. We encourage them to start screening. Turn it off. Sex. There are conditions that are associated with females, and there are those that are associated with males. There is also family history and the genetics. If you are from a history where they have tended to have diabetes, for example, they have tended to have hypertension, you have to watch. If you are from a home where people are obese, don't call it natural, don't call it a blessing. Try to work it out. There are other risk factors which we call physiological. At times we also call it metabolic, because meaning that your body is already involved. For example, obesity and overweight. Being obese is a disease that is usually less talked about, but obesity is associated with diabetes, is associated with heart conditions. It is also associated with chances of sudden death and other complications. High blood sugars. You may be normal, but if you don't know your blood sugar levels, you may find you are moving with high blood sugar levels. High blood pressure. You may be normal, but you find your pressures are high. They may not be high to to be quantified as having the disease, but you find your blood pressures are high. High cholesterol levels. These are referred to as physiological risk factors. Adopt a healthy lifestyle to prevent or slow the progress of NCDs. So whether you have an NCD or you haven't got, you still need to prevent. Because having an NCD is not an end. It can become complicated. You can halt it where it is. Actually, at times we choose not to call NCDs diseases, we choose to call them conditions, depending on how they are handled. You can be a diabetic and go around with your life. You can be hypertensive, you go around with your life. You have no marker that I'm a diabetic, and you keep it under control. But should you not keep it under control, then you have serious consequences. So how do we adopt a healthy lifestyle? The first point is a healthy diet. And Uganda is one of those countries, especially our towns, where we are rampantly abusing the food that we have. Instead of eating healthy food, we are indulging into unhealthy diets. We encourage Ugandans to eat more fruits, vegetables, whole grain products, and we discourage Ugandans from doing the following. We don't encourage Ugandans to eat high salted foods, processed foods, fast foods, like the chapatis you have just had, deep fried chicken, like the chicken you'll have at lunchtime, chips, like the chips you'll have at lunchtime, pork, especially fried pork. Reduce consumption of red meat and processed meats, especially those meatballs, refined sugars and sweets, sweetened beverages like sodas and alcohol. Sausages, all of those are processed meats. Take them at your own choice, but at worst, do not expose our children. For you as an adult, if you choose, then go through when you are exposing the children. Embrace a healthy plate. And what is a healthy plate? A healthy plate is constituted of 50% vegetables and fruits, 25% carbohydrates. That's the section that should have the posho, the millet, the maize, the rice, the potatoes, etc. And 25% the proteins. That should be the plate. And the proteins, I mean the meat, the beans, the peas, the fish. The other point is embrace and practice regular physical activity. At least make sure you exercise for 30 minutes for 5 times a week. That is about 150 minutes weekly. It is the responsibility of every Ugandan to be physically active without excuses. Stop smoking and second-hand smoking. Stop using alcohol if you can, and if you cannot, minimize as possible, because apparently we know that there is no benefit in using alcohol, contrary to the old science. Fight obesity and overweight and endeavor to reach and maintain a healthy weight. You have to continue fighting. Keep a close watch on your blood pressure, blood sugars, cholesterol levels by getting regular checkups. Preserve the environment and avoid the environment and occupational agents. Issues of open burning of waste in our homesteads and others. Even if you are in your first compound, you are contributing to environmental pollution, even when no one is seeing you. Leave alone the poor disposal of waste. Avoid unnecessary exposure to any form of radiation. Avoid exposure to any industrial and environmental toxins like asbestos. Avoid infections, like I said, that contribute to some NCDs. for example, human papilloma virus. Men can have HPV and they can pass it on to women. And for women, when you have this HPV, then the chances of developing cancer of the cervix is very high. If you are HIV positive, chances of developing this cancer and you have HPV is amplified 6 times. And for men, you can also graduate with the cancer of the penis. We don't usually talk about it, but it's also implicated. And of course, there are other issues, those other sexual practices that are undocumented, that people indulge in. You may end up getting cancer of the throat and those cancers because of those sexes that we indulge in. I hope you have gotten the point. Okay, avoiding